And what are they doing now that's different on this test than they did on the other one? They give you partial credit. So don't freak out about select alls anymore. Okay, page 7. Now, let me tell you what this page is really for, because you're never going to learn all this in one day. There's no way, and there's no way you could learn it well anyway. This is what you have to understand, though, before you take your test. So when you think about this page, and you think about all this crap over here, it's this page, right? And also, when you think about the 500 videos, it's this page. So this is called content. Some of you have heard maybe from your teacher or maybe even your friend that, well, I failed my test because I didn't know content. That means that you were doing questions on UWorld or some other software. God forbid your crazy ass chose Archer, because that's a piece of shit. But you were doing questions on something. But that's all you really were doing. Like, you really didn't learn very well because your school maybe was not the greatest school. Or you just didn't know it. You waited too long to take your test. You forgot a lot of stuff. Maybe you graduated a long time ago. That's what this troublemaker page is. And so what I tell you about this page is that these words may not show up on the test like they are here. So for example, let's look at this page and let's look at the bottom and let's look at where it says neuroleptic malignant syndrome, and right next to it, malignant hyperthermia. We keep the malignants together, right? So when you look at neuroleptic malignant syndrome, I give you my word that will never be on the test. Instead, a description of the patient will. So that's why we do toe-to-toe on Saturdays here in this class, because when I tell April, your patient came in, they're homeless, they're a psych patient, they have schizophrenia, and they haven't really done real well keeping up their prescriptions, so they always make sure that they get their medicines for the schizophrenia, but they don't always get both their meds. They just get one of them. And then I tell you that the patient is complaining about a severe headache and their neck is kind of stiff and they have a really high fever. Well, we teach you in this class so well, because it's always on a video somewhere, but we teach you so well that any psych patient with a fever, any psych patient with a fever is neuroleptic malignant syndrome, because what else could it possibly be? Nothing else. This patient is having a medication complication. They always get their psych meds, and then what psych meds could they possibly be on? Any antipsychotic could cause it. So you could say your Seroquel, your quetiapine, your Haldol, any of those meds can cause neuroleptic malignant syndrome. But they're never gonna say malignant syndrome on your test. They're gonna say the patient is a schizophrenic patient, they're on quetiapine, and they have a severe headache and a fever, and they're sweating profusely, and blah, blah, blah. So, boom, any psych patient with a fever, boom, you got it, okay? Now, you obviously have to know a lot more than that, like what are you gonna do about it, right? Okay, so these are just an example of what? If you read the top line, these are all the people you see first. Now, I did put them in a higher, lower priority on the page before that, didn't I? I just gave it to you, the top 7 or 8 that are really crazy. Okay, so what I'm gonna do, you're gonna see that just that little bit of time, we covered a lot of shit on here already, okay? So we covered the first 3 lines, didn't we? We covered agitation, restlessness, anxiety, blah, 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 blah. Okay? One that you might not have thought of is neck, face, chest, burn, surgery, or trauma. Yeah, let me tell you a little something. ABCs is not the way you prioritize, but ABC is important. It's just that if you want to use the ABCs, your A and your B must have what? A respiratory song attached to them. Y'all all right with that? But here's a little bit of AB, airway breathing, neck, face, trauma, right? Neck, face, chest, trauma, surgery, burns. That's easy, because here's what I'm going to tell you. Starting from here and moving up is a higher priority of the body. So what did I do? Neck, face, chest, trauma, burns, surgery. anything above the sternum is a higher priority than anything below it. Common sense, okay? So that's why that's there. Now, if you look at this other stuff, we already covered it. Grunting, flaring, retracting, aneurysm, new onset back pain, blah, 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 blah. You see that? You got this. We just did this. That whole bold print, we did it, okay? So a lot of these, as you go through them, you're like, oh my God, I remember talking about that in class. Others, you just gonna have to learn, which is why this takes time. Turn the page. Because I realize prioritization and delegation are very, very hard, I put another way of saying the same shit different day in this packet, and that's page 8. Page 8 is master, it's the bomb, it's the truth, it's everything you needed. But it's said in a different way to help you understand it. So you're gonna hear me repeat some things and you're gonna feel good about it because you now know why. So let's do it. Prioritization. Let me tell you what you do when you sit down and take this test and you get that who do you see first. This is what works every damn time. Even in my toe-to-toe, y'all did real good when you figured out how to get this. Once the nurse in my class figures out who is gonna die first, she good. That's what you ask. Could they die right now today? If they can't, don't see them first. If you look at that patient and you're like, oh, hell no, they ain't gonna die today. They just need a dressing change and a tube feeding. Okay, so they ain't gonna die today. They just need a dressing change. Because too many LPNs to RNs try to do tasks real fast. So you get that question about so-and-so need a tube feeding and a chest tube, whatever. And you're like, oh, I got something to do. No, fuck that. This one over here is restless with a PaO2 of 58. Sounds like evidence-based medicine to me. Okay? So, but it didn't sound that bad. So I'll give you this next one. This is a very popular one on the test. 78-year-old patient comes in. They are complaining of shortness of breath and they are coughing. And when they cough, their chest hurts. Their temperature is 104. Now, if you know your pathophys, isn't that airway all day? Okay. And then the 63-year-old patient comes in complaining of back pain that has gotten worse over the last hour, and they don't feel good at all. You already know, because you've been in here long enough since this morning, that that back pain is your bigger issue. Now, what did that other patient have? Pneumonia. But you got to know your pathophys to know it was pneumonia, because I said the chest pain hurt when he coughed. I didn't say the brother just had chest pain. I said when he coughed. That's boom, pneumonia all day. Now, don't get it twisted. He still get a fucking EKG, because he shouldn't have said them two words in one sentence. He should have never said chest pain ever to me. Okay? Never ever say that to me, unless you want a 12 lead. Okay? So what I'm trying to get you to do is read and go slow when you read and think about every word. Is there really evidence that this person's gonna what? Die today if you don't see him first. Okay? Now, here we go. Some of this is repetitive. I don't care because you gotta fucking know it. Never a priority. Teaching, tests, labs, procedures, pain unless what? Interfering with breathing, crying in psych patients, psychosocial. Chronic conditions like what? What's CKD? Kidney failure, heart failure, lung shit. Unless what? That's the part I want you to highlight because that's the part you fuck up. So let me say that again and be real clear about it. You know from school, do not see chronic patients first. The problem is your test is going to give you a chronic patient and they're going to say, lately they've had to sleep in the chair at night. Lately. That's a time word. Isn't that a time frame word? Lately. That's called new onset. That's another way of saying new onset. Remember that word? Okay, be careful, because what did I say? Unless worsening or new complaint of shortness of breath with a behavior change? What if the CHF patient is restless? That's a word. Yeah, girl. Okay, so now, always a priority. New admits, immediate post-ops, transfers, any crisis. This is a quote. Deteriorating conditions is a quote on your test. Highlight that word. Those words. Deteriorating conditions. I swear for everything that is on the test. In other words, they're going downhill quickly. That's what that means. Okay, here we go. SaO2 or pulse ox less than 90. We talked about that already. PaO2 less than 60. We talked about that already. Altered LOC, head, face, neck, chest, trauma, burn surgery, blah, blah, blah. Fever, sore throat, and immunosuppressed. New onset, worsening back pain. Home care patient. Stop right there. They're going to give you 6 home care patients and see which one you want to see first. Here's some hookup. Look at what I wrote. The home care patient with the central line or an IV is the person you're going to go to their house first. Stop talking about these 3 live over in the same area. I'm going to go over there first. Because that's how real home care nurses roll. I've been a home care nurse. I did it before. All the motherfuckers in Euclid. Shit, I'm going over there first. I'll see y'all over in the Heights in a minute. No, I didn't prioritize that right. You prioritize your home care by which one still has an IV or has a central line, because they ordinarily either just got out the hospital or they need some medications that are pretty serious for that central line. Those are your priority patients. Also, another way to prioritize your home care is the ones who just got out. Your ass just got out yesterday versus you've been my home care patient for 2 years. Please. We're finna see this post-op over here. Okay, so the next one says any CAS complaints except itching. Sound familiar? Yeah. Okay. Now let's do delegation. Delegation is easy and hard, but you got to be careful. Now let me tell you something. Holla back. Raise your hand if you're in Ohio only. Your test is out of Ohio. Raise your hand real high. Okay, real high. It's a lot of y'all in here. Come on. Come on, raise your hands. Okay, good. Okay, the rest of you guys, you may have to tweak the delegation a little bit based on your UWorld. Let me tell you why. Delegation is based on your state. Your state scope of practice dictates who can do what. In Ohio, we may not be able to do as much as a Florida LPN. Does that make sense? Okay, so you have to know a little bit about that. And the good news is pretty much there's nothing on your test that's going to be that hard that won't fit this page, okay? For the most part, this is every state. But there might be 1 or 2 items that you go, oh, we're allowed to do that now in our state. Well, okay, cool. But this for Ohio for sure. So here we go. Y'all ready? First of all, try to only delegate routine procedures and tasks. I know you've heard that before. I ain't worried about it. Never delegate. Now, I know it's your job they do, but this ain't your job. This is a bullshit test. We know at the job they do all of this dumb shit. But you taking a test. So here's what the test is going to say. Never delegate a new admission, a discharge, an immediate post-op. Don't be delegating that blood transfusion until after half an hour. Don't delegate them IV push medications. Remember that? Don't delegate unstable, pancreatitis, panic attacks, your TERPs. And here's a weird one. If the patient's refusing their meds, don't delegate that. Now that's your RN patient now, because you got to go find out what the fuck is wrong with them that they're refusing all their meds. Okay, so that's all about the RN that time. Don't delegate the task if the patient can be hurt. This is a good one. I do this at my job. I think about it before I delegate to somebody. Before I ask myself literally, if she fucked this up, will she kill or hurt or disable my patient? If the answer is possibly, I just don't delegate it. Fuck it, I'm gonna do it myself. Okay, so don't delegate anything that if it's done wrong could hurt the patient. Avoid delegate, this is in bold print. I expect you to highlight it. Avoid delegating the nursing process, assessing, teaching, evaluating, monitoring, observation, advise, check, recommend, review, coach, and encourage. Let's talk shop. If you have an LPN, are you delegating teaching? Do they do teaching? Yes, the fuck they do. Don't get it twisted. But the test is on some bullshit. So what is it called for the LPN that really is being delegated? You got it. I'm gonna write it on this board. Some of y'all may not know it. It's called reinforce. Now, in case you think this is just bullshit, let me tell you what Joint Commission did. Joint Commission came to one of our hospitals, and one of my nurses that was in my class, LPN or RN, her name is Mandy. She was working there that day. She was discharging her patient. Joint Commission was out in the hallway watching this whole thing go down. She comes out in the hallway. Joint Commission says, and just what did you do with that patient? She goes, oh, I just gave them their discharge instructions. Huh? Oh, shut up. It's 6 and 9. Shit, that's a good number. Last I know y'all got icicles on your eyelashes. Okay. Shut up. Your girl hot. Shit, fucking menopause. Shut up. Okay, children, I'm sorry I froze you. Pray about it. I told your punk ass to bring a hoodie. Okay. I did say that shit, man. Okay, y'all shut up. Now I'm telling y'all about Mandy. Okay, so Mandy got met with Joint Commission outside the room talking about, oh, okay, so what did you do with that patient? She said, oh, I just gave him discharge instructions. She goes, really? Come with me. She took that lady down that long ass hallway to the manager's office, and she confronted the manager and the nurse, my baby, in my class. So, you allow your LPNs to do discharge instructions now. Is that correct? Because she just did. She said she did, and I watched her. She certainly did it. They didn't know what to do with that. They got fined $50,000 that day. LPNs are not allowed to do that. So what should have changed? I was reinforcing instructions with the patient before they go home. You did the same shit you always do, but you didn't tell this bitch that. You said I reinforce instructions before they went home. Nothing wrong with that all day long. Then what make it so bad? Once you sign it, an RN would have to sign behind you. Thank God for Epic. Because now we don't have this big problem. But I don't know if you guys remember, we used to give a tear off to the patient with their discharge instructions on it. Now you can just print them down. But Joint Commission still wants to know, what did you just do? So remember LPN to say this word, reinforce. We all know it's bullshit. LPNs do everything we do, shit. Okay, for the most part. Except IV push med, shit, okay? All right, now, so here we go. You did the reinforce. There's something else that you don't want to do. Okay, this is an example that was on a test recently. The PCNA, your nursing assistant, did the blood pressure, and you delegated to the LP to go recheck it. Was that appropriate? No. If anything is abnormal, the PCNA telling you it's abnormal, it's the RN's job to go recheck it. And get this, when you recheck it, it must be manual. It can't be no damn Dynamap shit, okay? No monitor shit, okay? You got to recheck it with a manual. Remember I said that, okay? Because it's all in the little case study and everything. Okay, so just remember that. And then here we go. Avoid, oh, this is big. Avoid delegating initial. Highlight that word initial. What does that really mean, everyone? The first time. So here's an example. Your patient had a knee replacement, and you are telling the LPN they will need to be ambulated today. They had their surgery this morning, and wrong answer. Wrong answer. You ain't delegating the first ambulation to nobody. The RN has to do that. And better yet, physical therapy in most certain circumstances. But at least you have the authority to do it if they're not doing it. Okay, so that's a big one. Okay, initial feeds after stroke. Big one. Nah, you ain't delegating that. That is not a feed for your aide. No, it ain't. No, hell no. That's going to be an RN feed. I know it sounds crazy, but it's an RN feed after stroke. Okay, so there you go. Initial. Remember I said it. Okay, feeds. I did put it. Feeds of dysphagia patients are sterile procedures to UAPs. Your aides are not supposed to be doing sterile procedures, right? One of my son-in-law, I got him a job at the clinic as a PCNA, and we get ready to leave because I took him to work. We get ready to leave. He's like, I got a question. It might sound stupid, but am I allowed to do dressing changes? I said, hell to the fucking no. Who had you doing dressing changes? The trifling ass nurse, he had floated to a whole nother unit, a unit that I wasn't working on, so he didn't have me to grab. And she told him to do her dressing changes. All you got to do is put this on it, and this on it. I couldn't believe it. No, you're not delegating no damn dressing changes. Remember, dressing changes are still considered sterile because the gauze or whatever, the 4x4s and shit you put on it, they came out of sterile packaging. So you have to remember they're still sterile. So that was very inappropriate. I couldn't believe it. Told them to do the damn dressing changes. Okay, now here you go. Delegate to the LPN stable. Reinforced teaching. Oh, this is a good one to know. Insert, remove, or irrigate NG Foleys or anything. Okay, so just remember they can do all of that. IMs, your POs, almost every one of those they can do. Suture removal, antibiotics through PICC lines. A lot of you guys don't know that, but in Ohio, way back in 2013, LPNs can administer antibiotics through PICC lines anytime they want, and that's what they do. So you're good there. Let's see. Delegate to the UAP. I like these 3 words. They help you on the test. Remind, report, record, all of that. Just keep saying that to yourself on the test. Record, remind, report, any of that is fine. They can do AccuChecks, enemas, topicals, bladder scans, removal of IVs and catheters prior to discharge, after training. Ours all do. Every single one of our aides do all of that. Okay? And that's on the enemas and suppositories are on the test a lot. They can do those. Okay. So that's on there. Now, infectious disease.